Assalamualaikum. For this session, we will discuss about genetic disorders. Did you know what is genetic disorders? Genetic disorders is a disease that caused by a mutation in a DNA sequence of an individual. So, there are three forms of genetic disorders. First, chromosomal disorders. Second, single gene disorders. Third, polygenic inheritance. So, what is chromosomal disorders? Asma, can you help me define what is chromosomal disorders?
Yes, teacher. For the first type of genetic disorder is chromosomal disorder because of abnormal condition due to something unusual in an individual chromosomes. It can be categorized as either numerical or structural. Numerical abnormalities are whole chromosomes either missing from or extra to the normal pair. Structural abnormalities are when part of an individual chromosome is missing, extra, switched to another chromosome, or turned upside down. Structural chromosomal abnormalities result from breakage and incorrect rejoining of chromosomal segments. That's all, teacher.
Good, Asma. Afika, can you give me an example of chromosomal disorders?
Yes, teacher. The example is Klinefelter syndrome. Klinefelter syndrome is a genetic that means a boy who is born with this genetic condition will have an extra copy of X chromosome. So the result will be XXY chromosome compared to the normal boy who has XY chromosome only. Hence, this condition is also called as XXY syndrome. That's our teacher.
Well done, Afika. Atira, can you state the symptoms of Klinefelter syndrome?
Sure, teacher. The symptoms of Klinefelter syndrome are varying by age. Babies with KS have weak muscles, slow motor development, and delayed in speaking. For boys and teenagers, they have longer legs and broader hips. After puberty, they have less muscle, facial, and body hair compared with other teens, and small testes and penis too. Enlargement of breast tissue also occurs. Men who are suffering KS have low sperm count and increase their belly fat. That's it, teacher.
Good, Atira. So next, what is single gene disorders? Fatin, can you help me define what is single gene disorders?
Yes, teacher. As its name suggests, this type of mutation affected on a gene and is commonly hereditary. However, diseases from this mutation could be the result from different types of mutations at different severity and phenotype. There are three types of single gene disorders, which are autosomal recessive, autosomal dominant, and sex-linked chromosome.
Well done, Fatin. Okay. All right, Shakira, can you give me an example of single gene disorders?
Sure, teacher. The example is cystic fibrosis. The mutation occurs at cystic fibrosis transmembrane conductance regulator, the CFTR. It happened because of deletion of 3 bases on chromosome 7, and it is autosomal recessive disorder.
All right, thank you, Shakira. Aina, can you state the symptoms of single gene disorders?
Yes, teacher. People with cystic fibrosis will have problem with their bowel movement, and they are also at risk for getting lung infections and also difficulty in their breathing. That's all, teacher.
Good, Aina. So next, Batusha, can you help me define what is polygenic inheritance?
Yes, teacher. Polygenic inheritance, also known as quantitative inheritance, refer to a single inherited phenotypic trait that is controlled by 2 or more different genes. The example is human eyes color, skin color, weight, and height. That's all. Thank you, teacher.
Good, Patricia. So Raihan, can you give me an example of polygenic inheritance?
Yes, teacher. Diabetes mellitus is a metabolic disease that causes high blood sugar level. Diabetes mellitus consists of type 1 and type 2. Type 1 is when the pancreas produces little or no insulin at all, while for type 2, the pancreas makes insulin but it doesn't work as it should, where this is called as insistent. This can happen due to few factors such as family history, autoimmune disease, and lifestyle such as smoking and overweight. That's all, teacher.
Alright, thank you, Rehan. Dini, can you state the symptoms of diabetes mellitus?
Yes, teacher. The symptoms that the diabetes mellitus person will have includes frequent urination, increased thirst, increased hunger, even though that the person already eat before, unexplained weight loss, even though they always eat and feel hungry. Besides that, this person will feel tired, numbness, and tingling at the hand and feet. That's all, teacher.
Well done, Dini. So, thank you all.